Foreign Secretary, I just want to take you back to your opening remarks where you said our plan is working.
There are, of course, unfortunately, many deaths that also occur outside hospital. We're tracking behind Italy. We're following the same sort of path. What do I expect to see happen? I think this week's difficult. I think this week we're going to see a further increase. Thereafter, we should see a plateau as the effects of the social distancing come through. That plateau may last for some time and then begin to decrease. That's what we'd expect to see in this very unfortunate death curve.
As we're going through the peak of the crisis with the death toll at the level that it's at and increasing, we're absolutely keen to make sure, we're absolutely determined to keep our eye on the ball and our focus on what will save lives, which is people staying at home and protecting the NHS in that way.
Now, one of the things we want to do is to extend the amount of testing of people in care homes as the ability to test ramps up over the next few weeks. Because clearly, care homes are one of the areas where there are large numbers of vulnerable people, and that is an area of risk, and therefore we would very much would like to have much more extensive testing in that setting, and that will help with this.
Look, we understand the importance of getting the PPE to the front line, whether it's in care homes or the NHS. We're trying to give not just the staff on the front line the equipment, but the reassurance they need. I think the strongest reassurance, practical reassurance that they will want and that we can give them is that over the bank holiday weekend, over 16 million PPE items were delivered, and we're straining every sinew to roll them out even further and faster.
In terms of timing of changes, I think it's really important that we're now at a stage when you can begin to see the flattening. We'll look and see where the peak is and when we are firmly the other side of it in terms of numbers coming down. Only at that stage do you start looking at what measures might be released and how they might be released. It would be a complete waste of everything that everyone's had to do till now, and I absolutely understand the difficulties that some of the decisions make, but it would be a waste if we were to rapidly reverse that and lead to a re-emergence of this.
I don't think it is clear. I don't think those comparisons are like for like because of A, where we are on the curve, as Sir Patrick has mentioned, but also the individual circumstance in those countries. But we will continue to monitor, and we do monitor what's going on in other countries and make sure we feed that into what we're doing here. Patrick, I don't know if there's anything else you'd add to that.
No, I think it's very difficult to make those comparisons, and as I say, we'll be able to look and see this in due course. I think there's a lot to learn from other countries in terms of what we need to do, and we're definitely looking very closely at other countries in terms of how they think about release of lockdown measures.
Thanks, Adam. Thank you all very much.